Hello, Mrs. Drug Seeker. Oops, I mean Mrs. Smith. Welcome to Death Valley Medical Center. My name is Dr. Mason Stacy. What's going on today?
I had horrible back pain. I can hardly stand it. If I don't get something for my pain, I may die.
How did you hurt your back?
Well, I hurt it a few years ago in a terrible car accident that occurred while I was driving under the influence of alcohol and cocaine. Since then I have had chronic back pain every day. Then today I helped a friend move and felt it pop when I was carrying a grand piano all by myself about 8 hours ago. Ouch. 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 The pain is getting worse as I stand here. I am beginning to have total body numbness.
If your body is going numb, then the pain will stop.
No, when I have total body numbness, the only sensation that remains is pain, and since it is all I can feel, it is worse than regular pain. My pain is a 20 out of 10.
Sweet. The pain scale only goes as high as 10. 10 out of 10 pain is saying that your pain is the same as someone who is being dipped in hot oil. Is that what you are telling me?
No, I said it was a 20 out of 10. So my pain is worse than someone who is being dipped in hot oil.
Worse than that? But you are still able to sit there calmly and hold on to that bottle of alcohol in your hand. Nice. Do you have any other medical problems?
I suffer from mesothelioma. Jim Sokolov is working on my case now. I also have fibromyalgia, TMJ, phantom limb pain, trigeminal neuralgia, repetitive vomiting syndrome that occurs if I don't take more narcotics every 4 to 6 hours, and post-traumatic stress syndrome that I acquired after I watched a violent TV show.
Sweet. 1, 2, 3, 4, 5, 6.
What are you doing?
Counting to 10.
Why are you doing that?
So, I don't kill you right now by wrapping my stethoscope around your neck.
Do not touch my neck. I had a broken neck 2 weeks ago from when my pimp beat me up. That reminds me, I also have neck pain. It is terrible. Ouch. Ouch. Oh. Ouch.
I can't give you any narcotics if you are driving home.
I didn't drive here. I had to call an ambulance with my new iPhone because the seats in my BMW make my back hurt worse. And it was out of gas. I could not afford to fill my gas tank.
Why not?
How am I supposed to pay for my iPhone, BMW, cigarettes, alcohol, weekly manicures, new clothes, and still put gas in my car on the crappy little disability check I get every week?
Why are you on disability?
I am on disability because I have instant death syndrome.
You don't have instant death syndrome. If you had instant death syndrome, you would be dead already. That is why they call it instant death syndrome.
My chronic pain is terrible. I am starting to have abdominal pain. I think my repetitive vomiting syndrome is beginning to flare up. It has been 4 hours and 12 minutes since I chewed up my last 3 tabs of OxyContin.
Really? Really? You now have abdominal pain.
I will refuse any type of pelvic exam.
Thank God.
Are you paying attention to what I am telling you?
Yes, I'm required to pay attention and write down every complaint you have, no matter how stupid it is. Have you seen your primary care doctor for your chronic back pain?
I would have gone to see him, but I am in the process of suing him right now. Also, I am way too busy to make an appointment to see him.
Of course you are. You said you are unemployed. How can you be too busy?
It takes a great deal of time every day to go from emergency room to emergency room, to get the narcotics I need for my chronic pain, and to treat my repetitive vomiting syndrome. If you people didn't make me wait so long in the emergency rooms I go to, I would have more time. So, it is actually your fault that I can't get to my primary care office.
Nice. You have so many complaints, I can't keep track. What is it that you want?
I want you to fix my chronic pain today. I need you to give me narcotics. OxyContin, Percocet, Dilaudid and Vicodin. They are the only things that work.
This is not Burger King. You can't put in an order for what you want.
Oh, Burger King, that sounds good. I am so hungry. I asked that nurse over in the other patient's room for a sandwich, but she was very rude and ignored me.
Well, dumb ass. Did you happen to notice she was performing CPR at the time and trying to save that patient's life?
How was I supposed to know? This emergency room sucks. I am never coming here again.
That is what you said the last time you were here. I can give you some Tylenol or Motrin to help with your back pain today, and some Zofran for your repetitive vomiting syndrome. Which, by the way, is not a real syndrome. And possibly some Ativan to help you relax.
I cannot take Tylenol or Motrin. It gives me a fever. Zofran makes me throw up. And Ativan makes me anxious.
Do you think I just fell off a turnip truck yesterday? How can you take Percocet if you can't take Tylenol?
When Tylenol is mixed with Oxycodone, I do not get a fever. Actually, it is only the 10 milligrams Percocet that I can take, not the 5 milligram ones. Oh yeah. I am also allergic to green and red dye.
I don't care about your green and red dye allergy. Do you think I'm going to give you M&Ms while you are here?
My pain is getting worse. You are wasting my time with all of these questions. Are you going to do anything?
You mean anything besides going out to the nurse's station and making fun of you with all the other staff? Probably not. The nurse gave you some Toradol before I came in. It should have helped reduce your chronic back pain by now.
Then why am I still having horrible pain?
Because stupid hurts.
I hate this place. I am leaving. I hope you are not the doctor on the next time my instant death syndrome flares up.
Again, you don't have instant death syndrome. And today is my last day here at Death Valley Medical Center. So when you come back you can ask for the new director. Now all of this is his. He will be more than happy to see you on a weekly basis, so make sure you ask for him. His name is Chief Blazer.